Hi everyone, it's me again. Guess what? July is celebrated or seen as Fibroid Awareness Month. Now, I want to implore everyone today to become knowledgeable of what fibroids are, become knowledgeable of the symptoms, become knowledgeable of how you can help someone or a woman that's suffering from fibroids. Now, this plague that some women experience, not knowing the reasons sometimes as to why they are plagued with this disease. Sometimes we allude to different reasons based on research, based on what we have read, based on what the doctors say. But the doctor will tell you that there isn't any specific reason as to why. However, research has shown that there are different reasons. So it is said that the African woman is more prone to fibroids. It is also said that when you are in a certain age range, you are more prone to developing fibroids. It is said that when you eat a particular way, you are more prone to develop fibroids. It is said that when you use certain products, you are more prone to develop fibroids. It is said, based on when you started having children, you are more prone to have fibroids. So there are different reasons that people allude to as to why women experience this trauma, because it's a trauma. I have been experiencing this, and I must say that it is a daily fight. It is something that has caused me to pause, reflect, and assess my entire lifestyle and see when it started, when whatever was detected, what are my symptoms, what do I do that causes symptoms to be more extreme, what time of the month do my symptoms become more visible or more extreme. There are times in the month when I look like I am 6 months pregnant, while there are times when I look like I'm 2 months pregnant, and there are times when I look normal. So it is inconsistent in most cases. There are times when your whole body starts to malfunction, your kidneys, your heart rate, everything. And there are times when you are normal. So it is a chronic illness that you have to live with. Now, most people are told that you need to do a surgery to remove the fibroid or fibroids once they start to cause you not to function normally. You can't go to work, can't carry out your daily duties at home, you can't carry out your daily duties at work, you can't function normally, right? So many severe symptoms that I can't even start to explain. There are women who go to work normal and come back bleeding. There are women who have had so many mishaps on the road because of this disease, all right? Now, this month, I want women in general, whether or not you have been diagnosed with this illness, learn about it for more than one reason. Learn about it to see if you can assess yourself, to see if you are experiencing any similar symptoms. Learn about it so that you can see if you can actually prevent getting this illness before it actually happens. Learn about it so that you can become a better friend to someone that is experiencing this illness, or a better partner, or a better colleague, or just know how to deal with someone that's experiencing, because you can empathize and be more sympathetic. Now, I have been doing so many researches because there are herbs that are said to assist. And so while I'm on medication awaiting surgery, which is a possibility for me, I am trying to do the herbs. I'm trying to eat clean sometimes, but eating clean is not like what we would want it to be. So eat your fruits, eat your vegetables, but how often can you eat these? How long can these keep you full for? And you take your vitamins, you take some you try multiple suggestions and solutions to see if you can help yourself before you actually go under the knife. Going under the knife is another thing, because going under the knife alone has repercussions. When you do your reading and when you speak to people who have done surgeries, is a whole next routine you have to go adapt when you go under the knife. People still in pain, people, the after effect of surgery, of doing this surgery, if people should really speak up, all right, of removing your uterus, of removing the fibroid, 40% chance that it comes back. You remove a uterus, then you have more issues that you have to deal with because you removed your uterus. Right? You're going to menopause. That is one. Two, your ovaries. If the ovaries are left intact, then they have to go back after a certain amount of years and remove the ovaries. So they leave the ovaries so that they don't go into menopause straight away. But at the end of the day, they have to go back and remove the ovaries because it's going to dry up after a while and become it's unwanted at the time. So I guess it's going to stop functioning because whatever the blood was being transported to it is going to stop because they remove a uterus and all of that. So it's a whole lot of messed up situation happening in here. And people going to rush and tell you, go and do this, go and do that, go. But they don't know crap and they don't understand that when you remove something from your body that had a function and that was put there for something, a whole heap of something you remove. I just want to tell the women who have done these surgeries to be strong and that we are praying for you. We're praying for the women who are experiencing symptoms with fibroids. Presently, myself, I'm trying to eat clean. I'm trying to take my vitamins, taking my iron. I'm trying to follow some herbalists. And I try to find the bush that they said that are herbs, sorry, that they said that we should drink. And I'm trying that. Alright? No people may see me and they may say, you don't have fibroid. I try to work out as well. Alright? Because I realize that exercise and diet, that's very important. It doesn't matter what type of illness you have, it's very important. Because it helps you to combat, to fight whatever is happening in your body. Yes, it's stress. Stress is a serious sub. Stress make your everything amplified. Been telling people that. Yes, we are stressed. Life is stressful. Your workplace stressful. The home stressful. People in a relationship that's stressful. And then know that just make your body start malfunction or whatever illness you have. It gets worse. And then everything just start now work right for. And so sometimes you have to take a step back, assess at what point in time did their illness get worse, what would have caused it. Sometimes you have to be your own doctor and assess. Right? Everybody want to tell you what to do. Everybody have an idea. Everybody have a suggestion. Anything do you know, people? Everybody have something to say. Sometimes take a step back. Gather the opinions. Do your research. Assess your lifestyle. Assess yourself. And make smart decisions, not jump into anything, because sometimes you jump into things and it makes it worse. Alright? There are a lot of things that the fibroid can cause to go wrong in your body. My fibroid caused me, and the long standing, I'm thinking, caused me to have blood clot in my legs. So I had to fix that issue. Alright? Now, we just have to assess ourselves, because each individual situation is different. You may find one that is similar to what you're going through, but it is never the exact same. Similar, but never the exact same. Close, but not the same or the exact. So you learn from different people, and you learn and you gather information, and you see how best you can help yourself. Alright, so yeah. As I said, let this be the month that you learn more about fibroids as women, as men, young girls, all of that. Everything that we do, everything that we eat, everything that we do, everything that we think, everything contributes to our body, the function of our body. And when the illness enters our body and our body starts to deteriorate and malfunction and all that, so we have to really try to help ourselves. So to all my ladies who are experiencing the symptoms of fibroid, who are battling this traumatic illness, this mind-boggling illness, this life-altering illness, because nobody understands unless they are in the position, and everybody's situation is different. All right? Let me say that let this month be a month that you recognize, assess, and strategize, and learn a lot about what you're going through and how you can help yourself. All right? This is Sheila from FabFit reaching out to you. Have a FabFit day.